Hi friends, once again welcome back to the Nurse channel. So we are back after a short break. You all know that the most important AIIMS NORCET examination date is coming nearby. So keeping the AIIMS NORCET examination and other competitive nursing examinations, we are starting a new series, that is the AIIMS NORCET series. And in this series we will be including 15 questions which are taken from different parts or the different aspects of our nursing subjects, and these 15 questions will help you to prepare well for the upcoming examinations, especially AIIMS NORCET. So I request everyone who are watching this video to watch the video till the end, because you may know answer for some questions, but the options what I have given and the explanations for each options are very important. And in these videos I am giving you some clues or the hints that you have to refer later for better preparation. So once again, welcome you all back, and whoever not subscribed our channel yet, I request them to subscribe our channel and support us, and kindly enable the bell button so that you will get the notifications when we are uploading new videos. So welcoming you all once again to the AIIMS NORCET series, the 15 questions with very detailed explanation for a better preparation. So we'll move on to the questions. So the NORCET series, 15 question and answers with detailed explanation. So moving on to the first question in the series, and the first question is in the screen right now. So the question for you is, which among the following condition is also referred to as cervical dystonia? So cervical dystonia. So the options for you are option number A, spasmodic torticollis, option number B, kernicterus, option number C, opisthotonus, option number D, setting sun sign. So among these, which condition is also referred to as cervical dystonia? That is the question. So what is the answer? So the answer for this question is option number A, that is spasmodic torticollis. Okay, spasmodic torticollis. So we will see what is spasmodic torticollis and the other options also. Okay, so spasmodic torticollis, it is an extremely painful chronic neurological movement disorder causing the neck to involuntarily turn to the left, right, upward and or downwards. Okay, so the neck will be involuntarily turned to the left, right, upward and or downwards, and the condition is also referred to as cervical dystonia. So what is happening in spasmodic torticollis is there will be both agonist and antagonist muscles contract simultaneously during the dystonic movements. So there will be dystonic movements, and during that time there will be contraction of both agonist and antagonist muscles. Okay, so that is spasmodic torticollis. So we will see the other options which I have given in the question. So one among the other option was kernicterus. So you know that kernicterus, it is related to the bilirubin induced brain dysfunction or encephalopathy that can be seen in the infants. Okay, so I am giving you clue regarding the three classifications of kernicterus that you can refer later, and those are acute bilirubin encephalopathy or ABE, chronic bilirubin encephalopathy or CBE, and subtle bilirubin encephalopathy, that is SBE. So I am giving you a hint to learn the what all things you have to refer further. Okay, so in this you can see for the bilirubin levels and the periods of bilirubin exposure, those things you can refer and see later. Okay, so then the other option was the opisthotonus. So what is opisthotonus? Opisthotonus is a state of severe hyperextension and spasticity in which an individual's head, neck and spinal column enter into a complete bridging or arching position. So regarding opisthotonus and all, we have explained very well regarding in our old videos. So you can go and refer those videos for the detailed explanation of opisthotonus. And the final option was the setting sun sign. Okay, so what is setting sun sign? It refers to the downward displacement of the globes with lid retraction, and this sign, which is infrequently seen in infants, may be helpful in diagnosing patients with hydrocephalus or kernicterus. Okay, so setting sun sign is associated with hydrocephalus or kernicterus. Okay, so that is setting sun sign. So from the first question you are getting answer for another 3 questions. Okay, so we will move on to the next question in our series, that is the second question in the screen right now. So it's a very simple question, but It's slightly confusing. So which among the following medicines cause a profound and prolonged reduction of stomach acid production by inhibiting stomach's H plus K plus ATPase proton pump? Okay, so this is regarding a drug that is used for relieving the stomach acid production, and the mechanism is already explained in the question, that is inhibiting the stomach's H plus K plus ATPase proton pump. So from the key point proton pump, you can come to the answer to this question, and the options for you are option number A, ranitidine, option number B, omeprazole, option number C, cimetidine, and option number D, aluminium hydroxide. So you know that in the gastric acid secretion relieving, there are certain class of drugs, and which are these classes are slightly confusing. So at the end of this question, you will be knowing very well about these classes of drugs. Okay, so that is the purpose of this question. So the answer for this question is definitely option number B, that is omeprazole. Okay, so through the proper process of elimination also you can find out this answer, because ranitidine and cimetidine are coming under one group of drugs, and omeprazole is different, and aluminum hydroxide also is different. Okay, so we will see in detail regarding these classes of drugs in brief. So the first one is a proton pump inhibitors. What was the question asked? These are the class of medications that causes a profound and prolonged reduction of stomach acid production, and they do so by irreversibly inhibiting the stomach's H plus K plus ATPase proton pump. These are proton pump inhibitors, and the examples are omeprazole, pantoprazole, etc. Okay, so moving to the next class, that is the H2 antagonists. These are the another group of drugs that will reduce this acid production. So H2 antagonist, also called H2 blockers, these are a class of medications that block the action of histamine at the histamine H2 receptors of the parietal cells in the stomach. Okay, so this decreases the production of stomach acid. Okay, H2 receptor antagonist. So what are the examples? That is a ranitidine, cimetidine, etc. Okay, these are H2 antagonists. Okay, then comes the last one, that is the antacid. That's pure antacid. So what is an antacid? So as the name indicates, it is a substance which neutralizes the stomach acidity and is used to relieve heartburn, indigestion, or an upset stomach. So these antacids contain alkaline ions that chemically neutralize the stomach acid, reducing the damage to the stomach lining, esophagus, and thus by relieving the pain. Okay, so aluminium, these are the aluminium hydroxide, and a combination of salts can be used as the antacids. Okay, so these are the class of drugs that can relieve the stomach pain by reducing or neutralizing the acid production in the stomach. Okay, so I think that is clear for you. Now we will move on to the third question in our series, and the question is approximate length of a proctoscope is. So this is regarding proctoscope. So first of all, you should understand what is a proctoscope, and then approximate length of the proctoscope. So the options for you are option number A, 2 inches, option number B, 5 inches, option number C, 10 inches, and option number D, 15 inches. So there are chances that you can make this question wrong. So I will explain in detail in the explanation section. So the answer for this question is option number B, that is 5 inches. Okay, so first of all, you will see what is a proctoscope. So proctoscope, it is a short, straight, rigid, hollow metal tube, and usually has a small light bulb mounted at the end, and it is approximately 5 inches or 15 centimeter long. Okay, proctoscope is 5 inches or 15 centimeter long, while a rectoscope is approximately 10 inches or 25 centimeter. So for your better understanding, I have included a picture in this question. So here these are the three scopes that you can that can be asked for the exam. So first one is the anoscope, as the name indicates, to visualizing the anus. So we can see that anoscope is approximately 10 centimeter in the length, and then comes the proctoscope, which comes 13 centimeter, which is 13 centimeter long, and then comes the rectoscope, which is 25 centimeters long. Okay, these are the approximate things. Okay, so don't be confused between anoscope, proctoscope, and rectoscope. Okay, so I think that was very informative and informational question for you. Now we can move on to the next question in the series, that is the fourth question, and here your task is to expand DUB. Expand DUB. So the options for yours, the first one is dysfunctional uterine bleeding. Then option number B, dysfunctional ureterobladder. Then option number C, dysfunctional ureteric bleeding. And option number D, dysfunctional urethral bleeding. So maybe slightly confusing, but this is a very common term that you have learned in a particular subject. So the answer for this question is DUB stands for dysfunctional uterine bleeding. Okay, uterine bleeding. So what is DUB? It is defined as an abnormal uterine bleeding that results from an ovarian endocrinopathy and is not associated with any organic causes like tumor, infection, pregnancy, etc. So this bleeding is abnormal and this is related to ovarian endocrinopathy and it is not associated with any organic causes like tumor, infection, pregnancy, etc. Okay, so that is dysfunctional uterine bleeding or DUB. So I think that also was very informational. Then we will move on to the fifth question in our series. So the question is regarding the IQ test. Which is the most widely used IQ test for both adults and adolescents in the world? So most widely used IQ test, that is a question for you. And the options are option number A, Stanford-Binet intelligence test. Option number B, Wechsler intelligence test. Option number C, Denver developmental screening test. And the final option is all the above. So which test is the most widely used IQ test in the world? All three options are very, very important. So the answer for this question is not all the above. The answer is option number B, that is the Wechsler intelligence test. Okay, Wechsler intelligence test. So we will I'll explain these three tests which are very, very important. First of all, the answer for our question, that is the Wechsler Adult Intelligence Scale or WAIS, is an IQ test which is designed to measure intelligence and cognitive ability in adults and older adults. And it is the most widely used IQ test for both adults and older adults in the world. So keep this name in your mind, the Wechsler Adult Intelligence Scale. Okay, so next option was the Denver Developmental Screening Test or the DDST. So this was introduced in 1967 to identify young children up to the age of 6 with developmental problems. So the test addresses 4 domains. Okay, so that is important here. The Denver Developmental Test address 4 domains of child development, that is as personal, social, fine motor and adaptive, language and gross motor. Okay, personal, that is a social, then fine motor and adaptive, language and gross motor. And this is the most extensively used developmental screening test. So this is not an IQ test, this is the most extensively used developmental screening test. That is the answer for another question. Then we will see the another option, that was a Stanford-Binet intelligence test scale. So this is also another intelligence testing scale and it is a cognitive ability and intelligence test that is used to diagnose developmental or intellectual deficiencies in young children. Okay, so here the 5 factors being tested are, first one is the knowledge, then quantitative reasoning, then spatial processing, visual and spatial processing, then working memory and reasoning. Okay, and fluid reasoning. So these are the things that are tested in the Stanford-Binet intelligence scale. So this is also widely used but not for the older adults. Okay, so the question was regarding older adults and adolescents. Okay, so adolescents and adults. Okay, so I think that also was very informative. Now we will move on to the 6th question in our series, the 6th question. So this is regarding the hookworm treatment. The question is, which is not the drug used in hookworm treatment? So the question is, which is not the drug used in hookworm treatment? So what is the answer? So the options are option number A, albendazole, option number B, levamisole, option number C, mebendazole, and option number D, cotrimoxazole. So these all are sound like drugs, right? So which is not the drug used in the hookworm treatment? That is a question for you. So the answer for this question is option number D, that is cotrimoxazole. Okay, so it was a very easy question. So we will have a small explanation regarding this question. So you know that anti-helminthic medicines, that means the drugs that rid the body of parasitic worms. In that, albendazole and mebendazole are the drug of choice. Okay, classical drugs which are used for the treatment of hookworm infestations or infections. Then another drug, that is a levamisole. It is a medication which is used to treat parasitic worm infections, especially ascariasis and hookworm infection. So hookworm infection we can use albendazole, mebendazole and levamisole. But the last option what I have given was, that is a cotrimoxazole, otherwise known as the trimethoprim or sulfamethoxazole. It is a fixed dose combination antibiotic medication, that is not for the hookworm infestation and all. It is an antibiotic medication which is used to treat a variety of bacterial infections, that you can refer and see later. So that is the answer for that question. I think that was also a very good question for you. Moving on to the 7th question in our series. So this is from the community medicine, and the question is, which among the following is used to measure the amount of water vapor in the air? So it's a very simple question, but the options may confuse you. Okay, so the question is, the instrument which is used to measure the amount of water vapor in the air. So the answer options for you are option number A, barometer, option number B, hygrometer, option number C, psychrometer, and option number D, both B and C, that means hygrometer and psychrometer. So first of all, you should understand what is the term for the amount of water vapor in the air. Then you can identify the answer for this question very easily. So what is the answer? It's very simple. Answer is option number D, that is both B and C, that means hygrometer or psychrometer. So what is the term for the amount of water vapor in the air? That is the humidity. So the question was regarding the instrument which is used to measure the humidity. So we know that hygrometer, which is an instrument used in the meteorological science to measure the humidity or amount of water vapor in the air, and it is also called psychrometers. Why? Means because it is a type of hygrometer which is consisting of two thermometers, one of which has a dry bulb and the other bulb that is kept moist and ventilated. Okay, so hygrometer, I think you can you will understand it better if you are seeing this picture. So this is the classical hygrometer, and this one is a psychrometer. So in the psychrometer we have two thermometers, one is kept dry, the other one is kept moist and ventilated. So we have two thermometers, but in the classical hygrometer there is only one measurement. Okay, so this is the difference between two, but both of them both of it are used for measuring humidity. Okay, so I think that also was very informative. Now I think we can move on to the next question, that is the 8th question in our series. So this is regarding the echocardiography, and the question is, which kind of echocardiography may be recommended to diagnose coronary heart disease? Okay, so you should understand the various types of echo to answer this question. So here the question is, which echocardiogram is used to diagnose coronary heart disease? So the options are, first one is a thoracic echocardiography, then option number B, stress echocardiography, option number C, transesophageal echocardiography, and option number D, 3D echocardiography. So what is the answer? This is little advanced, so but you can answer it very easily. If you know what is coronary heart disease, then you can answer this very easily. So definitely the answer for this question is option number B, that is stress echocardiography. Okay, so you know that to check for a coronary heart disease, the person may get subjected to some sort of stress that will be in the form of a physical exercise. So here the examiner will take an echocardiogram before the test and one after the test. Okay, so one will be before the test, then will be given some sort of stress in the form of a physical exercise, then the next test will be done. So for continuous monitoring during this time, an ECG may be taken. So through this method, the strength of the heart muscles can be monitored. So for coronary heart disease, they will suggest for stress echocardiography. Then what about the other options? So the other options we will see, what is a transthoracic echocardiogram or TTE, transthoracic. So this is the most common type of echocardiogram, which is a still or moving image of the internal parts of the heart using ultrasound. Okay, see here also ultrasound is the method, and it is a moving or the still image of the internal parts of the heart can be detected, and it is a clinical tool to evaluate the structure and function of the heart, and all 4 chambers and all 4 valves can be assessed by transthoracic echocardiography. Okay, so that's a short note regarding the TTE. Then what is a transesophageal echocardiogram? So transesophageal echocardiogram, it is an alternative way to perform an echocardiogram. So it is an alternative way to perform an echocardiogram. A specialized probe containing an ultrasound transducer at its tip is passed into the patient's esophagus, and the advantages of transesophageal echocardiography over the transthoracic is it's usually clearer images, especially of the structures that are difficult to view transthoracically. So we will get a better or the clearer view in transesophageal echocardiography than the transtracheal echocardiography. Okay, transthoracic echocardiogram. Okay, so that's the answer. Now we'll move on to the next question in the series. That is the 9th question, and the question is, which of the following condition causes edema with hypoalbuminemia and decreased colloid osmotic pressure? So these are the key 2 terms which describes a particular disease. So that is the answer for this question, that is hypoalbuminemia and decreased colloid osmotic pressure. So don't skip if you know the answer, because I will be explaining regarding the edemas that can be seen in different conditions, what I have explained in the options. So the options are, the first one is the nephrotic syndrome, option number B primary hyperaldosteronism, option number C renal failure, and option number D Graves' disease. So hypoalbuminemia and decreased colloid osmotic pressure. So what is the answer? Obviously the answer you know, that is the option number A, nephrotic syndrome. So I have kept 3 other options. In that conditions also there are edema and there are lack of edema, that will be explaining in the explanation session. So first of all, nephrotic syndrome, as you know, it is a collection of symptoms due to the kidney damage, and this includes protein in the urine, that is a proteinuria, low blood albumin levels, that is hypoalbuminemia, high blood lipids, that is hyperlipidemia, and significant swelling, that is edema. Okay, so these are the classical terms that can be explained in nephrotic syndrome, which includes high protein in the urine, low blood albumin levels, high blood lipid levels, and significant swelling. Okay, so that is nephrotic syndrome. So we will see the another options and where I have explained the characteristics of edema. So what is a primary aldosteronism or Cone syndrome? So primary aldosteronism, otherwise known as the Cone syndrome, it refers to excess production of hormone aldosterone from the adrenal glands, which results in low renin levels and high blood pressure. So here you should understand the renin-angiotensin aldosterone mechanism, which I have explained many times in our older videos. So first of all, you can go through that, then you can understand it better. So in primary aldosteronism or the Cone syndrome, there will be lack of edema. Why? Which is results from spontaneous natriuresis and diuresis. There will be spontaneous diuresis and natriuresis. It is known as the aldosterone escape. Okay, so what is aldosterone escape? That is the answer for another question. Aldosterone escape is the lack of edema which is resulting in primary aldosteronism from the spontaneous natriuresis and diuresis that occurs in patients with primary hypoaldosteronism. Okay, and it appears to be mediated by atrial natriuretic peptide, that is ANP. So where this atrial natriuretic peptide is released. So that is also answer for another question that you can refer and see. Okay, so this is primary aldosteronism or Cone's syndrome. Okay, now so there is no edema. That is a hint for you in concern to this question. Then what is hypervolemia and what is happening in the primary glomerulonephropathy? The thing is that actually the hypervolemia and edema in the renal failure results from the primary salt retention and GFR reduction, which is due to the glomerulonephropathy. So this is happening in the, what is happening in renal failure is hypervolemia and edema are happening because of GFR reduction due to glomerulopathy. Okay, so For last option was regarding the Graves' disease. So what is Graves' disease? This is also known as a toxic diffuse goiter, and it is an autoimmune disease that affects the thyroid, that is hyperthyroidism. So in Graves' disease, it is thought that the fibroblast stimulation by the thyroid stimulating hormone receptor increases the deposition of glycosaminoglycan, which results in an osmotic edema and fluid retention. So in Graves' disease also there will be fluid retention and edema will be there, and the pathology behind this is the stimulation by the TSH receptor increases the deposition of glycosaminoglycan that can result in the osmotic edema and fluid retention. Okay, so that's all regarding that question. I think that was very informative. Then we will move on to the 10th question in our series. This is from the Fundamentals of Nursing, and the question is, self-care deficit theory was proposed by whom? So whose theory is the self-care deficit theory? So the options are, first one is the Virginia Henderson, option number B Betty Newman, option number C Imogen King, and option number D Dorothea Oram. So self-care deficit theory. I know it's a very dry thing, but there are chances like these type of questions also can be asked. So you will be knowing about the 4 theories through this question. So the answer for this question is the Dorothea Oram. Okay, so you know that Dorothea Oram self-care deficit theory focuses on each individual's ability to perform self-care, defined as the practice of activities that individual initiate and perform on their own behalf in maintaining the life, health and well-being. So self-care, Dorothea Oram. So these 2 words keep in mind. Then another personality was the Henderson, and Henderson's theory is the need theory. Virginia Henderson's need theory, it emphasizes the importance of patient independence so that the patient will continue to progress after being released from the hospital. So that is the need theory by the Henderson. Then third one was the goal attainment theory, and this goal attainment theory was by the Imogen King. Okay, so this was first introduced in 1960s, and from the title itself, the model focuses on the attainment of certain life goals. So that is a theory of goal attainment by Imogen King. And one more theory I will explain, that is the Newman's theory, Newman's system model. Newman's systems model, very important. It is a nursing theory which is based on the individual's relationship to stress, the reaction to it, and reconstitution factors that are dynamic in nature. So the theory was developed by Betty Newman. So I have given you a clue regarding the 4 important theories in our nursing and the founders of those theories. Okay, so there are chances like you can get questions based on these theories. Okay, so I think that was very informative for you. Now we will move on to the 11th question in our series. So another confusing question: which hormone is responsible for a sense of temporary pleasure? Okay, temporary pleasure, that is a key point in this question, and the options for you are option number A serotonin, option number B adrenaline, option number C dopamine, option number D noradrenaline. So I think you can omit 2 options very easily. So the other 2 options may be confusing for you. So the key point in this question is temporary pleasure, not permanent pleasure. Temporary, long-term pressure, this is temporary pressure. So the answer for this question is option number C dopamine, not serotonin. Why? That will be explaining in this session. So when dopamine is released in our brain, we feel a sense of temporary pressure. And serotonin, while similar to the dopamine, creates a long-lasting feeling of happiness or well-being. Okay, so that is a thing you have to understand. Dopamine is for a temporary pressure, and serotonin is for a long-lasting feeling. Okay, long-term pleasure. Okay, so other 2 options I think you know that adrenaline and noradrenaline, that is a stress related to the stress or the flight or fight response, that all things you know. Norepinephrine is continuously released into the circulation at low levels, while epinephrine only released during the times of stress. Okay, so I think that also was a very good question for you. Now I think we can move on to the 12th question in our series, and the question, another very important question: which among the following diseases is associated with excess buildup of copper in the body. So among these options, which disease is associated with excess deposition of copper in the body? So the options are option number A, Wilson's disease, option number B, Wilms tumor, option number C, West syndrome, and option number D, Wernicke's encephalopathy. Wernicke's encephalopathy. So all options starting with W to confuse you. Okay, so what is the answer? Copper in the body, excess copper. So the answer is obviously that is a Wilson's disease. Okay, so the answer is the option number A, that is Wilson's disease, and we will have a small explanation regarding the Wilson's disease. So you know that Wilson's disease, this is a genetic disorder in which excess copper builds up in the body. So symptoms are typically related to the brain and liver. So symptoms will be to the brain and liver. So the liver related symptoms include vomiting, weakness, fluid buildup in the abdomen, that is ascites, then swelling of the legs, then jaundice, that is yellowish skin, and itchiness will be there. Okay, so these are the liver related symptoms. And what are all the brain related symptoms? It includes tremors, muscle stiffness, trouble in speaking, personality changes, anxiety, and psychosis. Okay, so this is the classical features of Wilson's disease. Copper buildup in the body, two areas, that is in the liver and in the brain. Okay, so don't forget. So what about the other options? Another option was the Wilms tumor. So this is related to the kidney, also known as the nephroblastoma. It is a cancer of the kidneys that typically occurs in children and rarely in adults, and occurs most commonly as a renal tumor in child patients. Okay, so Wilms tumor, otherwise known as nephroblastoma, children. Okay, these three terms keep in mind. Then another option was the epileptic spasm, otherwise known as the West syndrome. So what is West syndrome or epileptic spasm? So it is an uncommon to rare epileptic disorder in infants. This is also happening in infants, and the epileptic seizures observed in infants with West syndrome fall into three categories, collectively known as infantile spasm. So I am not going to explain regarding these three categories and all, that you can refer later. These are the hints that I am giving to through this video to refer further or to learn further. Okay, so infantile spasm or epileptic spasm, otherwise known as the West syndrome. Okay, so don't forget. Now another option was the Wernicke's encephalopathy. So regarding this, I have explained very well regarding in our older videos. So Wernicke's encephalopathy, otherwise known as the wet brain. Okay, wet brain. This is the presence of neurological symptoms caused by the biochemical lesions of the central nervous system after exhaustion of the B vitamin reserves. That means B vitamin deficiency, particularly thiamine, that is vitamin B1. So keep in mind Wernicke's encephalopathy, otherwise known as wet brain, deficiency of vitamin B1, commonly happening in chronic alcoholic patients. Okay, so that is Wernicke's encephalopathy. Now we will move. I think you are getting bunch of information from these questions. So moving on to the very next question in our series, that is the 13th question. So this is from the anatomy, and the question is, Descemet's membrane is a part of which organ? So where you can find Descemet's membrane? And the options for you are option number A, ear, option number B, cornea, option number C, prostate, and option number D, ovary. So where you can find Descemet's membrane? So the answer for this question is option number B, that is cornea. Okay, so you know that in the cornea it is comprised of 5 layers, and nearly one more layer has been introduced. That I think that is a Duas layer. Okay, so the 5 layers are the epithelium, the Bowman's layer. Bowman's layer, it is also there in the structure of nephrons. So don't be confused. Epithelium, Bowman's capsule in the this one. Okay, nephron. So epithelium, Bowman's layer, the stroma, Descemet's membrane, and the endothelium. So I am not going in depth into the function and the physiology of these layers. So just to keep in mind these points. Okay, and one more layer has been introduced. I think that is a Duos layer. Okay, so that's all regarding the structure of cornea. Now we will move on to the second last question in our series, that is regarding the blood sampling, and the question is, blood sample for coagulation studies need to be collected in vacutainers containing which chemical? So we know that there are several types of vacutainers for several blood investigations. So for coagulation studies, which vacutainer you will take? So, or vacutainer with what chemical will be used? So the options are, first one is the EDTA, ethylene diamine tetraacetate. Then option number B is the serum separator. Then option number C, sodium citrate. And option number D, sodium polyanethol sulfonate. So what is the answer? Coagulation studies. So the answer for this question is option number C, that is sodium citrate. So the other options, like EDTA, serum separator, sodium polyanethol sulfonate, all these chemicals are used for which test? That I will be explaining in the explanation session. So have a look on that. We know that EDTA, and for EDTA, that whole blood test like CBC, ESR, Coombs test, platelet antibodies, flow cytometry, blood levels of tacrolimus, cyclosporin. Then another so many investigations are there. These are regularly what we are using is the pathological investigations like CBC, ESR, etc. That is the EDTA sample. Okay, usually comes in the purple color vacuotinous. Okay, EDTA. Then another is the serum separator. Serum separator for the routine biochemistry test. Okay, serum separator, because we need to separate the serum and the plasma. Okay, so that is a serum separator. Then next comes the sodium citrate. Sodium citrate is a coagulation test. Okay, such as prothrombin time and partial thromboplastin time and thrombin time. Okay, so these coagulation studies are using sodium citrate chemical in the vacuotina. So actually like light blue colored vacuotinous will be there, okay, for the coagulation studies. And one important thing while collecting for coagulation studies are we have to collect it fully. Okay, and final was the sodium polyanethol and sulfonate. So this is an anticoagulant and it is used as a growth media for microorganisms for blood culture. So you know that in the blood culture bottle there is a chemical, and that chemical is a sodium polyanethol sulfonate, and it is used as a growth media for the blood culturing. Okay, so I think that also was very good and informative question for you. Now we are coming to the end of this session. That is the 15th question in our series, and this is a picture based question, image based question, what we can expect in AIIMS NORCET. So your task is to identify the image. So I have given here an instrument, so you have to identify what it is. And to assist you, there are options. The first option is a urethral stent. The second option is a cuscospeculum. Option number C is a urethral bougie. And option number D is a uterine curette. So what is this? What is this instrument? So this is option number C, urethral bougie. So you have heard about the bougie for the endotracheal intubation. So this is for the urethra. Why? What is the purpose? So the urethral bougies are usually used to treat the urethral strictures. So to open the urethral strictures, we are using these urethral bougies, and stricture that you know that the narrowing of the urethra resulting in difficulties in urine flow. So this is urethral bougie. Then we will see the other options with picture. So what is a urethral stent? So this is a urethral stent. You can see what this is, urethral stent. And a urethral stent is a soft hollow tube that is placed temporarily into the ureter, and the stent allows the urine to drain, and the stent has a coil on each end that keeps it from moving. The top end coil rests in the kidney, and the lower end coils inside the bladder. Okay, so this will be in the kidney and this will be in the bladder, and it allows for the free flow of urine. Okay, so that is a urethral stent. So what is the use of urethral stent? What is the purpose, indications? Those things you can refer, that can be asked for the examinations. Okay, so another option was a curette. So what is a curette? So this is a picture of a curette, double-sided curette, and there are several types of curette that you can refer later. This is a surgical instrument which is used for scraping or debriding biological tissues or debris for a biopsy, excision or cleaning procedure. Okay, so dilatation and curettage, that is in the OBG, you know that D&C. For that purpose this curette is used, and there are several types of curettes that you can refer later. Okay, so then the last option was the bivalve speculum or the cuscus speculum. So what is a cuscus speculum or bivalve speculum? This is a two-bladed or bivalve speculum, which is the most common type of instrument which is used to examine the vagina and cervix. Okay, so this is, I think you know this, very frequently used instrument in the OBG. Okay, so I think from this question you are getting information regarding 4 picture based questions. Okay, so with that we are coming to the end of this first session. So that is the AIIMS NORCET series. I hope all these questions what I have explained in the sessions are very important, and more than questions, the explanations are also very important. I think this was very useful for you. So keep in touch for the next videos to come, and at the same time, if you have any queries regarding these questions, or if you want any clarification regarding any of the topics, you are free to ask in our comment section. So once again, thank you for watching the video till the end. So see you in the next video. Till that time, signing off. Bye.